Osteosarcoma, which means malignant tumor of bone. It is the most common primary bone tumor in the dogs. In the dogs, it usually occurs in the large and giant breed such as Great Dane, Saint Bernard, Doberman, Rottweiler, German Shepherd, etc. For large or giant breed of dogs, osteosarcoma most commonly affect the appendicular skeletal. Appendicular skeletal means bones of the limbs. So, osteosarcoma affect the long bones of the front and the hind leg. But for the smaller breed of dogs, osteosarcoma tend to develop on the axial skeletal. In that, most common locations are the bones of the skull. For example, mandible, maxilla, etc. and scapula, ribs, spine, pelvis, etc. Before going ahead, let's look at the anatomy of the long bone briefly. As you can see on the picture that epiphysis means rounded or expanded end portion of the long bone, and diaphysis is the sharp portion of the long bone as shown in the picture. Now there is another term, that is the metaphysis, which means neck portion of the long bone between the epiphysis and the diaphysis, exactly that you can see on the picture. And this osteosarcoma tumor occur in the metaphyseal region of the long bone. So please remember this important detail. Generally, osteosarcoma affect the distal radius, proximal humerus, distal femur and proximal tibia part of the long bone. Exactly that you can see on the picture. To remember this easily, I will give you a trick. Away from the elbow and towards the knee. Just remember this sentence and it is easy to remember. For example, as you can see on the picture that distal radius and proximal humerus both are away from the elbow joint and distal femur and proximal tibia is towards the knee joint. Moreover, as a rule, osteosarcoma doesn't cross the joint, meaning if osteosarcoma affects the distal portion of the radius, it does not cross the adjacent bone. For clinical signs and symptoms, if a dog is presented for a chronic progressive lameness or acute lameness after an incident such as jumping off the couch or out of the car, then suspect for the osteosarcoma. You may also find the productive and destructive lesion on the metaphyseal region of the long bone with the soft tissue swelling and with the pain on the palpation. These are some important signs that are associated with the osteosarcoma. To understand it better, let's look at the radiograph. As you can see on the radiograph, the distal portion of the radius, that is the metaphyseal region of the long bone, is clearly showing the osteolytic lesion, meaning the pieces of bone are missing, of course due to the osteosarcoma tumor. And it gives the moth-eaten appearance, exactly that you can see on the picture, due to the loss of normal bone tissue. Here you will ask, what is the osteolytic lesion? Cancer can cause certain changes in the bone architecture, which is known as osteolysis, and it weakens the bone and sometimes lead to the fracture. And this type of fracture is known as pathological fracture. And this is the important sign that is associated with the osteosarcoma. The blue arrow denoting the soft tissue swelling near the tumor area. The yellow arrow denoting the periosteal proliferation. Periosteum means sheath that covers the bone. From the radiograph, you can say that tumor is unable to spread to the carpus and metacarpal bone. So remember, osteosarcoma do not cross the joint into the adjacent bone. The most common site for the metastasis is the lungs. So remember, pulmonary metastasis can occur in the case of osteosarcoma. So it is important that if you diagnose the osteosarcoma, then take the 3-view chest radiograph to see if there is metastasis present or not. However, pulmonary metastasis visible in less than 10% of cases at the time of diagnosis. A more definitive diagnosis obtained by a needle aspiration and the biopsy. On the blood work, we can see elevation in the alkaline phosphatase. Finally, let's understand the treatment aspect. Amputation of the affected part is the most effective treatment for the osteosarcoma. I know it is very unappealing for you and most of the owner, but most dogs do very well after the amputation. It is very hard decision to take, I know, but we must have to accept the fact that osteosarcoma can metastasize to the lung, then after it becomes impossible to treat the osteosarcoma. Following amputation, we can use the limb sparing procedure, which include surgical removal of the bone tumor with the replacement of the prosthetic at the osteotomy site. Second treatment option is the chemotherapy. Chemotherapy combined with the amputation can increase the survival time of the patient. Cisplatin or carboplatin is a platinum type of anti-neoplastic drug that can be used to treat the osteosarcoma. And doxorubicin is also an anti-neoplastic drug that we can also use to treat the osteosarcoma. If owner refuses to go for the amputation surgery, then we can use the biphosphonate group of drug, and they are also known as the osteoclast inhibitor. For example, we can use the palmidronate that reduces the further bone breakdown. Without surgery, the patient have only few weeks to live. But with the amputation alone, survival time increase up to the 3 months. And with the amputation and the chemotherapy, the survival time can increase up to the 10 month to the 12 month. I hope this video is helpful to you. So guys, प्रेम से बोलो राधे राधे.